Every American should take monkeypox seriously, and every American must do their part to help us beat back monkeypox.
That is a change. Remember just a few months ago when our public health officials said, don't worry about monkeypox. Not a big deal. You're not going to get it. Well, turns out it's a lot more contagious than public health officials told us or led us to believe. Testing for monkeypox is still a mess, and vaccines are tough to come by.
It's like the Hunger Games. Trying to get online and actually you have to be there with multiple tabs open. It was a hassle and it was a pain.
Yeah, I had the time to sit there and refresh it for other friends, but not everyone can do that.
How long would you say it took you to get?
Over an hour.
Kind of reminds you of COVID almost, but it's not COVID, it's monkeypox. Don't worry though, the White House, FDA, CDC say they have a plan. They will cut each dose of the current vaccine stockpile into 5. In other words, a single vaccine dose of monkeypox for 5 people.
Today, the FDA has issued an emergency use authorization, or EUA, allowing healthcare providers to use an alternative dosing regimen of the Jynneos vaccine. This will increase the total number of doses available for use by up to 5-fold.
To allow vaccine providers to use an existing 1-dose vial of the vaccine to administer a total of up to 5 separate doses.
Yes, if you're wondering, that's the same FDA that screwed up the baby formula shortage. Dr. Amish Adalja, senior scholar, Johns Hopkins Center for Health Security, adjunct professor, Johns Hopkins Bloomberg School of Public Health. Boy, these are the same people who told us, hey, get the COVID vaccine, you're not going to get COVID. It's really kind of scary that people don't trust them. Are we right to be skeptical?
I think it's right to always question what's being what the optimum policy is. But in this case, I agree with this policy that I think that with what we know about the monkeypox vaccine, what we know about the supplies, and what we know about intradermal injection. So it's not just that they're diluting it and giving it the normal way, it's that they're going to give it under the skin, which is a place where we know there are lots of immune cells where we can get away with lower doses. So I think this is a reasonable approach in a situation where we don't have enough vaccine to vaccinate the 1.6 million Americans that are at risk.
You say the 1.6 million that are at risk. We've been told that it's essentially men who have sex with men, the gay population in America. Then you hear, though, from Javier Becerra that everyone should be concerned. We had Dr. Lahid on a couple of days ago. He said that it can spread through contact with other surfaces, bedding, all sorts of doorknobs and everything else. Is monkeypox a little bit more transmissible than we were led to believe?
No, I don't think so. I think what we know is that, yes, it can infect anyone. But what we see in this outbreak, specifically with the epidemiology, is that this is concentrated amongst men who have sex with men. This is not something where I think we'll see general spread throughout the population the way, for example, a respiratory virus spreads. This isn't a very contagious virus in the sense that during the incubation period, you're not contagious. And it does require close contact, not casual contact, to spread. We will see some spillover cases outside of the target population of the vaccine, but I don't necessarily think you're going to see sustained transmission. So I think this is something that's not of the same caliber as COVID-19 or what H1N1 was in 2009. It doesn't have pandemic potential, but it is something we need to be serious about because these mess ups and these bungles from the federal government are something that are worrisome because this tells us that we're not ready to respond to infectious disease emergencies, even after the mistakes of COVID-19.
Yeah, even when it comes to the issue of treating this, New York Times headline, there's just one drug to treat monkeypox. Good luck getting it. It requires 27 pages of documentation by a doctor. Is it that the federal bureaucracy just won't change? Is it that we haven't cleaned house? You study these things. What do your colleagues say has to happen to first actually fix the competence issue and then fix the trust issue?
I think we really have to reevaluate how the U.S. government responds to infectious disease emergencies. It's just not up to par. In the example you give of TPOXX, the antiviral, the fact that you've got to fill out mountains of paperwork in order to get this to a patient really isn't conducive to people actually prescribing it. So the barriers that are being erected to us responding optimally to this are government-induced barriers. So that's why there's a public health emergency declaration to cut the red tape and the bureaucracy. And what we've seen throughout this outbreak is much more loyalty to bureaucracy than to doing what's right. And that's not how you want to respond to an infectious disease emergency.
Yeah, loyalty to bureaucracy. Really stunning, especially as you point out, after COVID, that we learned that was so difficult. Hey, Doc, it's good to see you as always. Thank you.
Thanks for having me.
Yeah, appreciate it. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.